And then, so the next speaker I have is Farah. She'll be talking to you about perinatal nursing. Thanks.
Thank you so much, Cindy. Good afternoon, everybody. My name is Farah Jetta, and I'm the program head for the perinatal specialty, and we welcome you here to the information session. So perinatal, what is perinatal? The perinatal specialty is, registered nurses working in partnership with childbearing individuals, their newborns, and their families, really to provide nursing care, education, support to patients and their families throughout the trajectory of starting from pregnancy, all into labor and birth, and then into post-delivery called postpartum, and then the first sort of few weeks of the newborn. And like all of our nursing environments, perinatal nursing clinical context is also very dynamic. It's ever-changing, it's unpredictable. And so perinatal nursing really requires a strong knowledge base, technical expertise, very sort of strong clinical decision-making skills, and relational nursing practice. One of the sort of the things we know about perinatal nursing is that the nurse is sort of in the middle of the whole sort of context of what's happening, and other healthcare providers come in and out, but it's the perinatal nurse that really is in the middle of everything, especially in labor and birth. So having those relational nursing skills are essential. Next slide, please, Julie. So who is this for? Like Cindy said in her program, and Kathy said earlier, this is for active registered nurses that are seeking an advanced sort of perinatal nursing certification to work in our perinatal birthing units, undergraduate nurses that are currently completing an accredited BSN program. And when we think about sort of traits or characteristics of people that are wanting to work in the specialty, really sort of enjoying working directly with women, newborns, and their families. We always tell people that come into our program that you should be very flexible, and you should be very sort of okay being around a lot of family members. There's a lot of family members, usually not as much with COVID, obviously, but usually lots of different family members coming and going. Thrive in a very fast-paced, dynamic, unpredictable environment. Have very strong organization, prioritization skills, because things are changing so very quickly, and working with multiple patients sometimes. Strong communication skills, because not only are you communicating with patients and their families, but you're communicating with multiple healthcare team members that are also coming in and out of the situation. And again, as we talk clinical decision-making skills, be really strong as an effective team member working in a multidisciplinary team, adaptable, flexible. You really don't know what's coming around the corner, especially when you're working in a birthing unit. You could have a mother that's coming in, that is in early labor and may be sent home, or you even may have somebody else coming in who is in strong labor that might be imminently delivering. So that aspect of the unknown should be something that maybe you seek out, or that you enjoy doing. Knowing when to ask for support, so really understanding your own strengths and knowing when to ask for help, and then being really self-reflective as a practitioner. Next slide, Julie. So program overview, this is a benchmark for perinatal practice in BC. So nurses working in perinatal units, this is the program that nurses are completing in order to work in the units, in the hospitals in British Columbia. It's a comprehensive program, like all of the specialty programs in BCIT, that combine in-depth theory, simulation, and strong clinical courses delivered by very knowledgeable and very sort of passionate and experienced faculty. As Kathy Kennedy mentioned earlier, this is a part-time program that can be completed course by course with an average of about 2 years, or can also be completed in a different pathway called a sponsored pathway, which is sort of more of a full-time pathway, which I can answer questions about later or individually as well. And because this is distance, as Kathy Kennedy mentioned, gives you lots of flexibility while you study or work or have other life events happen. Next slide, Julie. So this is a 24 credit program. And as you can see, the courses are listed there. We've got theory courses. We've got three theory courses, a couple of workshops. Our workshops are 1 credit courses, which are 72.50 and 74.50. I won't inundate you sort of with the specifics of the courses, but we've got 3 theory courses, which are 3 credits each, 2 workshops, which are 1 credit each, and then the 2 clinical courses, which are 5 credits each, and a 3 credit elective. If you're interested in our electives, we've got a whole slew of electives listed in our website on the web. The blue courses that are listed are for those that might be interested in taking some of our courses while in BSN programs. So 7100 is our Theory 1 course, 7150 is our infant feeding course, and 7450 is a neonatal resuscitation program or NRP course. These are courses that really fit well in undergraduate studies because they really help you after graduation to start working in a postpartum or a post-delivery hospital unit that can really sort of help the transition into perinatal quite nicely. So those are the 3 courses that are highly recommended for BSN learners. Next slide, Julie. And then, where can people work with this specialty? So again, primarily, as I mentioned, in sort of those acute care birthing units in the Lower Mainland, in the province, and then other work opportunities could be sort of in the community or the public health sector, really working as a public health nurse with, families that have delivered and have gone home, supporting with breastfeeding, supporting with immunizations, and then also working on sort of pregnancy or antepartum units, and then post-delivery or postpartum units in the hospital settings. Next slide. And then this is just some of our team and some of sort of what people have said, what learners have said in the past. So I'll just give you a couple of minutes to read over some of the comments. And if you have any questions, of course, my contact information is on the next slide and on our website as well. We've also got a wonderful program assistant, Zoe Lai, and she'll be happy to answer your questions as well. So please feel free to reach out.